actually started out in a small abandoned gold mining town, but moved to the Paw, where I lived from the time I was 5 to about 18 or so, I guess. And then moved to Winnipeg and married, and I took a scenic route into school and eventually medicine. And I first became interested in research actually when I was working with the federal government. So I started with my thesis, and then I did a small project with the Manitoba Métis Federation in analyzing the Aboriginal People Survey for them. And so that actually just took, that was about three years in developing that relationship, because despite being Métis, it doesn't really mean that you can automatically say, oh, well, I'm going to go and do Métis research, right? There was no process in place to do more than a thesis. There was no mechanism to reach Métis communities. At that time, there had only been one single study done on Métis in Manitoba, and it was within one single region. And it was actually looked very bad because it was actually the worst, one of the worst regions in terms of their health status. So there's this whole journey, you know, and being an immigrant to Winnipeg, I really didn't know the Winnipeg Aboriginal community at that time. Like, you're just pretty isolated when you move from the north. The director of the Manitoba Métis Federation, the executive director, phoned me because I had shown this interest in engaging over the years, and phoned me to meet with me to see if I knew of anyone who might be interested in starting and developing a Métis health department for them. So I just said, it's me, you know. So I did that, and I went over there and set up a health and wellness department that is essentially a policy and research and knowledge translation unit. So we really needed to be able to have much more detailed Métis health status information. The first thing I did was I approached Pat Martins at the Manitoba Centre for Health Policy and said, would you be interested in doing a Métis health status study with us? It worked out really well. The study was called Métis Need to Know 2. And it was sort of a take-off of Pat Martin's study of the Need to Know study, which was a knowledge translation study where she worked with regional health authorities and the academic system to do studies and then talk about them and help the regional health authorities understand what the data were saying so that they could then take that into policy and programs. So what I did with the Métis Need to Know 2 study was continued with the academic, continued with the regional health authorities, but added the community. So you now had a stool that had 3 legs. I set up first the first two knowledge networks at the department that I developed over there. And as a result of the Métis Atlas, the big health status study, that study, and the public health funds, we were able to set up 10, over about a 2.5-year period. There were 11 regional health authorities and 7 MMF regions, right? 10 of the 11 regional health authorities participated in these knowledge networks, and all 7 of the Métis regions participated. So it was all set up in a way that everyone felt safe. The knowledge networks, each knowledge network did a personal assessment, a group assessment, learned how to create wellness areas, then use those 8 wellness areas to develop a 10-year vision. But ultimately, what we found was that right in the process of doing the knowledge networks, someone from the RHA would say, oh, we could make that change right away, you know, because the planning is a non-pressure planning. It's simply, let's all put our best thinking on the table and not worry about who, not bring any blame into anything. There's no one out there who wants to see anyone having poor health, right? You know, I can't really say too much about the process, but just the fact that it's at this point a really positive process all around, you know, and it's very focused only on research, not on anything else, because we're researchers. So then I still remain a technician. Like I do research, I know and understand things, but I also know that ultimately the direction has to come from the community. And the community in Manitoba would mean, you know, locals, regions, the MMF, and at the national level, it means the Métis National Council. What was interesting is it took that long to make the relationship, to build a sense of trust, that I'm here not simply to do a research project, I'm here to build a long-term relationship. And being Métis helps, because this is about my family as much as it is about all other Métis in Manitoba. You know, I mean, I'm from a family with 10 siblings, so we're a good Catholic Métis family. I actually had to move out of the academic environment. So even though I always had an office here, I actually moved and went and worked 3.5 days a week at the Manitoba Métis Federation. It's getting better. Currently, there's a group of us working at a national level because of the CIHR changes in the way it's going to fund health research. And there was a number of us that saw this as a major issue, not just to Aboriginal health, but to population and public health. And it's happened also in the ethics side. If you look at the Tri-Council policy, it started with CIHR, Institute of Aboriginal People's Health. They did the first sort of take on building an ethics platform, and it was important to say First Nation, Métis, and Inuit. I think there are more people, at least a few more people, doing Métis research now. And it's partly been because of the MMF Health and Wellness Department being developed, and the quantitative research being done and being out there. And suddenly people going, wow, here's a population that really needs some attention.